arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, folks. I'm Lou Biazzi with All County Healthcare. We have a special guest tonight, David Selzer. David is at NYU Langone. First question, David, I want to ask you. By the way, I hope you're all staying healthy out there, wearing your mask, and doing the things you have to do, social distance, until you get your vaccine. And, Doc, we're going to ask you about what's happening with COVID. But right now, you're with NYU and Langone as an internist in nephrology, correct?
Yeah.
Explain to me what a lot of people say, well, what is NYU Langone?
So NYU Langone is based out of New York City.
Mm-hmm.
It's New York University. It's been named after Dr. Kenneth Langone. He was the donator and benefactor of the university. And they approached me about 3.5 years ago about starting medical practice in the South Florida region. So what they did was they bought out a cardiac division under Dr. Lewis Snyder. And then I myself, along with Dr. Thomas Rockland, we started an internal medicine division in West Palm Beach. And we've been slowly growing it. Since then, we've added an endocrinologist. We've added a nurse practitioner. And we're looking to keep growing to better serve the South Florida population with New York-based physicians.
Well, that's fantastic. One of your offices, I understand, is at West Palm Beach, 101 North Clematis Street?
Yes.
And that phone number is 561-365-3000. Listen, 565-3000, that's an easy number to remember. And I tell you, this gentleman, I've had him on once before when he first came into town. And he's growing like crazy because he's got to be a fantastic physician, as he specializes, I guess, in internal medicine and nephrology. And what hospitals are you affiliated with, Doc?
I'm affiliated with Good Sam Hospital, that's in West Palm Beach,
Mm-hmm.
and Delray Medical Center in Delray.
So you serve both parts of the county?
Yes.
The south part and the...
Personally, I'm in Delray Monday, Wednesday, Friday, and West Palm Beach Tuesday, Thursday. But the lines have really, how do we say, they're not as concrete as they used to be, simply because with telemedicine, I find that I'm serving both patient populations at the same time, because any day of the week that a patient has an issue, they can always call up and set up a video visit.
So really, medicine has changed since COVID, correct?
Medicine has dramatically changed. It's not what it used to be. I think access to care has increased dramatically, secondary to the allowance for video technology, which was always there in the last 30 years, to be able to go into the medical field. Allowing patients to be able to just basically sit in their own private home and be able to communicate with their physician has changed the ballgame. First of all, for our elderly patients, 2 issues come about. One is, besides COVID-19, let's just put that aside for a moment, and the infectious risk in regard to being with other people. Just going out and forcing them to leave their home, out of their comfort place, go to the doctor. It's a little bit difficult, especially for older patients who have difficulty walking, who become short of breath because of pulmonary issues. Just getting to the doctor's office and having to have their child take them often becomes an arduous and difficult task, as opposed to just going on their cell phone makes life so much simpler. And second of all, when explaining to patients what their medical issues are based on their labs or their imaging or consultations with other physicians, when you place an 80-year-old patient in their own home and you talk to them, their cognitive ability to understand what you are expressing to them increases dramatically. When you put someone in their comfort zone, they will think and understand much better than when they are in a doctor's office and they're busy with nurses and they're sort of overwhelmed by the whole atmosphere.
With their white coat syndrome.
They get white coat syndrome. People's blood pressures are lower
Right.
at home than it is in the office. So when you do that and when you make people feel more comfortable, they will better understand you and better listen to what you have to say.
Well, that's fantastic. Now, let me ask you, when you're saying on COVID, what are some of the reasons, what's coming up right now about COVID? How is the depression setting in? They find that you find a lot of people are depressed because of the COVID situation?
So I think the anxiety and depression that has existed because of COVID has never been seen before. Just because the amount of uncertainty about the virus and the ostracization that it's caused, meaning there are people who are stuck in their homes, their apartments, all by themselves, and they spent their whole lives waiting to get to South Florida and retire, and now they're all by themselves. You know, I always quote my mother when she says, I crossed the Tappan Zee Bridge from Rockland to Westchester, for those who know the area, to go to work for 25 years to get my pension in order so that now I can retire in South Florida. If you told that person, and there's a million Mona Selzers out there, that now they have to sit in their home all day, every day by themselves, they're not exactly happy to do that. But so that leads to so much of frustration and depression and anxiety that we as a medical office are trying to help alleviate for people. It's a challenge for the typical physician.
One of the things I heard yesterday, the other day on the phone, is the amount of suicide in younger people. It's just amazing how much it's gone up because of the depression, the COVID, not studying at school. Mm-hmm. So I'm sure the seniors have that same problem, especially if they're living alone.
So I'm not surprised that the suicide rate would go up in the younger population, simply because younger people are generally more aggressive, and therefore suicide is by definition an aggressive action. So I don't think it would go up so much in elderly as a aggressive attack on themselves, but more of a passive way, meaning I don't think people are jumping off the bridge as much in the 70 and 80-year-old population, but I think they'll stop taking their medication that will keep them well, and that will be sort of a passive way. And it's sad. And our job as medical professionals is to help them and to prevent that from happening. So what I do in my personal offices, I have my nurse practitioner, Ms. McFarland. She does a lot of our emotional therapy, and she does a lot of talk therapy to help patients sort of overcome that. Additionally, we started a chronic care management program which is headed by our nurse, Ms. Rachel Franco, and she actively calls our patients every single month and goes through an entire list and spends 20 to 30 minutes every month discussing with patients their problems. And even if nothing really gets resolved, even if there's no answer to the question that's at hand, that moment where somebody calls and reaches out to that next person can really change a person's day, month, week, year, knowing that there's someone out there that actually cares about them.
Well, I can relate to that because I'm a senior and I live alone, and I realize that how many nights I go home and say, well, where are you going? Well, I'm going to go home to my four walls and ceiling.
Right.
So you look at four walls and ceiling, you can only look at so much TV, right?
Right.
And, it gets difficult when you're alone, and I feel for seniors, and that's what we do at All County. All County Healthcare, we're a home care agency that takes care of the seniors, and we also practice what we call behavioral health. And we're seeing a lot of seniors that have this problem with behavioral health because, sometimes the only visit seniors get is between your visit to calling and our visit, right?
Right.
Sometimes they don't even have a family member calling them, or they might not have any family members. So the next question I'm asking you, I'm trying to get a COVID vaccine shot, just like everybody else around this town. They tell me Publix has got it, this one's got it, that one's got it. Can't get it, all right? So now the situation is, where do you see COVID going, and what do you see any hope that this thing is going to be cured?
I always see hope.
Well, you're optimistic.
I definitely am optimistic. I would say there's two aspects to the COVID-19 vaccine rollout that I think we should all realize. Number one, for the person who's frustrated, and there's a lot of people out there who are frustrated by the difficulties of the rollout, shall we say, know that every single day people are getting vaccinated. Real people are getting vaccinated. That means they're coming off the list and making it easier for the next person to get vaccinated. And secondly, I think we should take a moment and think about the COVID-19 vaccine. The mental brain power that was used to create that COVID-19 vaccine, how they are using mRNA technology that was never ever used before. And
what type of technology now?
mRNA.
What's that mean?
So you have DNA.
Yep.
Okay, so that's what we're all made of. That comes from our parents and whatnot. Then it goes to RNA, and then it goes to protein.
Mm-hmm.
So what they had to do is previously vaccines were based out of egg-based vaccines, and now they started to make it into an mRNA-based vaccine. So in order to keep that mRNA going into your body, they had to freeze it first to keep it stable because it's inherently unstable. That's why the Pfizer vaccine and Moderna vaccine has to be frozen at such low temperatures as compared to like your influenza vaccine. And you're wondering, why can this guy keep it in the fridge and the other vaccine has to be in the freezers? Because you're using a different type of technology that needs such cold temperatures or else it will be unstable. So they're using this new technology that's proven efficacious at a level that was never considered a possibility. Do you know that the FDA said that if you can get a vaccine that would be 50% effective, we would consider it to be a godsend? We're at 95% for both vaccines. Right? Now, you had the brain power and the energy and effort to create this vaccine, and they did it. And it's an amazing accomplishment. Whatever you think about Trump and politics, who cares? The scientific accomplishment is amazing. And now we're at this last step, the rollout. And we can't seem to get it right. And I'm not criticizing anybody, but I think we should all take a moment and ask and tell ourselves, who in my life is helping me do what I do on a typical day? Who in my life is helping me get through my day? Because I'm realizing that it's not just enough about what I do. I need other people to accomplish things. I think COVID-19 has ostracized us from each other, but I think the rollout is making us realize that we need each other to accomplish something great. We need each other to accomplish the logistics.
So that goes back to being together.
We have to go back together to make this all work, as opposed to what COVID-19 did, which ostracized us and put us all apart.
But I see, let's take a little break here. Can we take a little break for 30 seconds? Take a little break for 30 seconds. We'll be right back. Okay. And I'm going to get...
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
As you see, we're back with Dr. Selzer. And I got to tell you, for a young man with this knowledge, you've got to call his office. You've got to set up an appointment. 561-365-3000. That's 561-365-3000. He's in internal medicine. And I got to tell you, some of the things he's going to tell you about what kind of testing he does for the individuals. When you go into his office, he gives you a full-blown test. As a matter of fact, we have a couple of questions from the audience. I have Ed Salazar. Ed, could you ask us the question that you want to address to Dr. Selzer, please?
Well, as Dr. Selzer knows, I'm a respiratory therapist, and All County Healthcare is one of the few respiratory, or one of the few agencies, Medicare agencies, that has a respiratory therapist. And I deeply appreciate the comments that Dr. Selzer has made about COVID-19 and the importance of good respiratory care in treating these patients, especially at home. My thought is, virtually everyone from the Northeast and perhaps the Midwest, Mid-Atlantic states as well, everybody knows about NYU Langone, but not so much here in South Florida. What I would like to know is, besides the locations where you work in South Florida, what is the scope of services that are offered?
So right now we do internal medicine, nephrology, endocrinology, and cardiology. We also do physical therapy, and we run a chronic care management program. In addition, we also run weight loss programs. We're trying to expand, and we're trying to increase our range of physicians and nurses and social workers that we have on our staff. Now, Rome wasn't built in a day, and that is something that I've learned over time. And what I think is our main goal is to provide good care. And it doesn't matter how many subspecialists or internists or nurses or nurse practitioners, and those are all important. But when we're looking to grow, we're looking to add people who care about their patients. And sometimes it takes a little bit extra time to find the right person. So it's a slow growth, even though I'm proud of the growth that we had, but it's a slow growth. And what's important is that we find the right people. We recently added an endocrinologist, Dr. Maria Tolpan, and her and I very much think alike, where we have an approach to how we treat a patient. And it doesn't matter if your focus inherently is nephrology or your focus inherently is endocrinology. The focus is the patient, and how do we make them, him or her, better at their health. And that's sort of our main goal. So we're trying to add different people, but we have to make sure we get the right positions, the right people to fill the right positions.
Well, that's so nice to hear today, because you usually see some doctors say, "Oh, I need to take 70 patients to make my payroll," or "I need this," because medicine became money. Medicine is not medicine. It's nice to see a doctor who says, "Doc, you'll take as much time as you need with the patient to explain to him what's the situation." All right. Now, what are some of the things you do when you get a new patient, as far as testing? They come into the office. I understand you go one step beyond what the average doctor does.
So let's say you would have a typical 70-year-old gentleman who walks into your office. So the first thing that you want to screen for is diabetes, hypertension. You want to check their cholesterol, but you want to go that extra mile for that patient. You want to offer them more. You don't want to just do what the regular person out there may go. So let's say they have high cholesterol, and you're looking at their cholesterol and you're seeing their LDL is 130 or 140. So you have two options. You can just give them some statin medication and say, "Goodbye, Charlie." Or you can say, "You know what, go get that CT calcium. Let's see how much plaque is inside your heart that has developed." Because your cholesterol numbers are only a reflection of what your cholesterol has been in the last week or so, or 2 weeks or so, when I just met you in the week or so. But how do I know what it's been for the last 20 years? How do I know how you've taken care of yourself? So when I'm looking at a CT calcium, I can sort of tell how much the plaque burden has been.
What is a CT calcium?
So it's a test that tells me how much calcium buildup has been made in the coronary arteries, meaning the arteries that lead toward the heart. So if I see that it's extremely elevated, right? So then I'm going to try to lower that cholesterol even further than compared to what I would do for a typical regular patient. Now, if it's extremely elevated, I'm going to start saying, "Hey, you need to get either a stress test or a CT angio, or maybe somebody has to go in and do a little rotor-rooter job to make sure you clean it out." But I'd rather get that screening test done earlier and be more aggressive in the first place than pretend everything's fine. So when, especially, someone, let's say a 75-year-old gentleman, there's somebody's father, there's somebody's grandfather. They're coming in, they're trusting you. They want you to tell me, to try to predict to the best of your ability, will something bad or negative happen to them in the next year or two? And now, nobody's perfect and nobody knows the future, but one of our jobs is to try to help patients prevent a problem than always be reactive. So our goal a lot of times is to be preventative than as opposed to be reactive.
Listen to what the doc just said. I'll guarantee that you've gone to probably 100 primary care physicians. No one even mentioned to you for CT scan, because I think the CT scan has to be paid privately, Doc?
So yes, this is actually National Heart Month, February.
Right.
So all the cardiologists are happy. And when you do National Heart Month, a lot of the imaging centers actually lower the price of CT calcium scores in order to because of the holiday for cardiac reasons. So I know. So it's definitely, I know. I'm pretty sure in Bethesda last year they did half off during National Heart Month for the cost of CT calcium scores. But insurances sadly don't pay for these tests, so it comes out of people's pockets, and not everybody can
That
afford
sounds
it.
stupid. I mean, they could save for $100 or $50. They get a CT scan. Insurance Medicare won't pay for it, but they'll pay for $30,000 operation.
So I don't run Medicare, but I just try to work within the system. I just sort of work here. And yeah, there's some fallacies in the system that don't make sense. Meaning, why does Medicare only pay for medications once you have the disease, as opposed to they probably are more effective if you did it before a person got the disease? And there's many medications that are like that.
Well, it's not only Medicare, it's Medicare Advantage plans. Say, oh, wait, well, I'm not going to get into that. But let's get into this here. For $50 or $100, isn't it worth for you to go out and even see Dr. Selzer? Say, Doc, I just want out of that CT scan that you talked about. And maybe we can start from there. Because if you're suffering from any kind of chest pains, you go to a cardiologist. He might take an EKG. I'm sure you take the EKG too, right?
We do EKGs on every patient.
And so that CT scan, I find very few internists do that.
Well, I'm lucky enough that I work in a cardiac division with Dr. Lou Snyder and Dr. Stephen Saltz and Dr. Ivan Carnado, Dr. Stephen Cohen. And, when you work with people, there's a lot you can learn, and there's much to glean. I pride myself on claiming to not know everything and always having an eager to learn, as opposed to claiming that I know it all. So there's always more books to read, and there's always more to study in order to try to become the better physician that I aim to be.
Well, I tell you, you're extremely impressive as a physician, and I'm glad to see there's some physicians out there that really, really care about the patients. I always said medicine is money, but there are physicians out there who put the patient first. And you seem to be the one that's putting the patient first.
I don't want to take credit for that.
Take credit for it. No problem.
I think NYU should be known as an organization that takes to put the patient first. And that's the mantra that starts with Mr. Ken Langone and works all the way down to every doctor and nurse and medical assistant that works there. It's an attitude of we have to realize that we're doing God's work and that we are here to help the people and that we've studied for many years and that our goal is to help mankind. And then if we can and then we will be paid both in this world and going forward, and we go from there.
Another question. To avoid, heart disease or any kind of disease to stay healthy, what do you recommend as far as diet for seniors or exercise for seniors or, I got 2 bad knees, so I can't go run 5 miles.
So the music's playing, but we do a lot of physical therapy in our office, and that helps people get stronger, faster. Our physical therapist, Dr. Nicole Cox, she specializes in spinal physical therapy. And personally, I had an ankle surgery in August, and she's helped me recover and get strength back in my left ankle. And I owe her a lot of gratitude. And I think that the more physical therapy that we can help people and the more we can help people get up and move and get around, the better off we all can be.
Oh, that's fantastic. So let me ask you a question. How much time I got? They cut me off already? Oh, my God. Dr. Selzer, I want to thank you again for coming. You got to come back on the show, please.
Pleasure and an honor to be here.
Remember, reach Dr. Selzer at 561-365-3000. He's located in West Palm Beach. He also does Delray. And he's affiliated with Good Sam and the Delray Hospital. Doc, thanks a million. You were fantastic. Wish it was an hour show. I could have talked to you for 2 hours. But you got to come back soon.
I will. Thank you.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station,